Hi, I'm Brandis, and welcome to Q&A Wednesday, where you get to ask your health and wellness questions and I get to answer them. Today's question comes from Brenda, and she writes, Dear Brandis, I've had ongoing low back pain for a couple of years now and have recently been told that my ongoing pain and discomfort might be coming from tightness in my hips. Can you help explain this a little bit better so that I can understand the connection and also teach some stretches that might be helpful for me? Okay, Brenda. Yes, I can definitely help with this. I think it's important to know that oftentimes in our body, when there is an area that perhaps is unstable or really mobile, that another area of our body can get really tight to try to help compensate for that. And so what might be happening is that you have this ongoing low back discomfort, and you stretch and you stretch and you stretch, and maybe it gets a little better, but it's still there. And so the low back actually becomes the part of our body that presents with discomfort, when in reality it's being caused by something else. And for you, it sounds like it might be coming from tightness in your hips. So last week's Q&A Wednesday, we talked about how to strengthen the hips, which is also extremely important in that stability for our pelvis and our core. So if you haven't watched that, go back to last week and watch it, where we talk about a lot of hip strengthening. But for this week, for all practical purposes from what you've described, we are going to focus on stretches. So the reason our low back can be uncomfortable or have discomfort and have it actually relate to our hips and our pelvis is because there are so many connections. So our hip joints are right here. They meet our pelvis. Our pelvis meets our low back. So anything that's happening down here can affect up higher, and also vice versa. So you can't necessarily address one without addressing the other because there's so many connections. You also have connections at, let's say, the hamstrings, which attach at the base of the pelvis. So perhaps you've heard, or some of you have heard, if you have low back discomfort, they'll say, well, stretch your hamstrings. The reason is because if our hamstrings are tight, and our hamstrings go from just below our knee, they come up and they attach right at the base of our pelvis. But if there's tightness in the hamstrings, that can pull on the pelvis, which can create low back pain. Our quads, or our hip flexors, there's two main muscle groups. So you have your quadricep muscles, which are your thigh muscles, and they attach at just below the knee, and then they come up, and there's a couple different attachments up here at the pelvis. So those muscles, the quads, they help extend the knee. They also help bend the hip. But you also have deeper hip muscles, which attach basically at the sides of your spine, and they come forward and attach on the inside of your pelvis. I call them the deep hip flexors, okay? So if there's tightness in there, that can also affect or pull on your low back, creating back pain, when in reality it's coming from potentially your hip flexors. You can also have tightness in the outer part of your leg and hip in what is called the IT band. Most people have heard of this, when in reality there can be tightness in the muscle within the IT band called the tensor fasciae lata, and that's right here in the hip. Or tightness in one of your quadricep muscles, your thigh muscles in the front, and one of your hamstring muscles in the back, and they parallel your IT band. So tightness in any of those areas can pull on your pelvis and create low back pain. So a few of my favorite stretches are going to be as follows, and I encourage you to try these, but see which ones work the best for you, because all of our bodies are different, and our discomfort and tightness can be caused by any of these areas and also other areas. So give these a try, see what works for you. And of course, I do always encourage, if you have not, or if you're a person who has pain and have not been fully evaluated and assessed by a physical therapist, please do so. It's always best to get to the root cause of your pain and discomfort before just trying to do something on your own to see if it works, okay? So these are my most common stretches that I would give for tightness in the hips, but also pertaining to low back discomfort or tightness, okay? So the first one is going to be a single knee to chest stretch. You'll lower yourself down onto the floor, knees are going to be bent, and you're just going to grasp behind your knee and gently pull towards you. This is a great stretch for your hip. It also, when you bring your leg up, it also lengthens the muscles in the back of your pelvis, your glutes or your butt muscles basically, as well as stretching up into the low back. So this is a great stretch. You can do one leg at a time or you can do both legs at the same time. And I usually have people hold for breaths instead of seconds. So 3 to 5 really nice deep breaths on each side. The second stretch is for your hamstrings, so the muscles in the back of your leg. And from here, it's nice because you can just lift the leg up towards the sky. Lead with your heel. That will stretch more into the back versus with your toe, but either way, whichever way is most comfortable. Again, you're going to hold your hamstring stretch for 3 to 5 nice deep breaths, and then you would just kind of release out of it slowly and hold again. The third stretch that I recommend is more of an active, a passive motion, and we call it hip telescoping. So your knee is bent, but you're holding behind. You can hold over your knee for this and the knee to chest stretch, but sometimes if there's any knee discomfort, we don't want that, so then I recommend holding underneath. Because your leg is already up here, the goal is that the leg and the hip and the back muscles are relaxed, and so you're going to use your arms to draw a circle with the top of your knee. And it's very slow and controlled, but the goal is that you're actually getting stretching and range of motion in your hip socket by moving your leg, and your arms are doing the work. And you'll do some counterclockwise and clockwise, usually say 5 to 10 each direction. And you can make the circle as small or as big as you want to, but you want to make sure that as you're doing it, your pelvis isn't rocking all over the place, okay? So you might want to engage that lower abdominal muscle just slightly to give yourself some stability at your pelvis, because then it really isolates the movement out into your hip. The next stretch that is a favorite of mine are windshield wipers. So if you're lying on a yoga mat, you're going to place your feet on the outside edges, and then you're just going to lower your legs from side to side. And you want to work within a range of motion that's comfortable for you. So for example, if I went this far but it was uncomfortable or it hurt up into my back, that's too far. But this maybe feels really good. So you could use some yoga blocks underneath or pillows underneath your upper, your leg and your knee for support, so you can just kind of relax into it. You can also gently pull that lower abdominal muscle up and in to give your low back some stability so that you don't hinge at your low back. And then more of the movement will happen at the hip. So I still have my lower abdominal muscles engaged. I'm lowering my knees down. My hip and my pelvis are going to gently lift up from the floor. But I don't want this. I don't want hinging at my low back. That's not good. So you want to pull the lower abdominal muscles in if that's happening, and then go through the movements. And your arms can be at your side, they can be overhead. This one is a really great full body stretch. In standing, you are going to cross your left foot over your right, like this, and then you're going to stick your right hip out, okay? Keep your lower abdominal muscles gently engaged to protect your low back so you don't hinge. And then from here, you can lift the arm up overhead for a full body side stretch. You can even rotate forward slightly to get more into the back of the body, but you are also stretching out this right side of your hip into that tensor fascia lata muscle that we had talked about earlier, as well as into the IT band. So you can be here. If this is challenging for balance, you can always put your hands on a table, a counter, a chair, just something that's sturdy and won't flip on you. And again, you hold for 3 to 5 breaths, and then uncross, and then the right foot goes over and crosses to the left, that's uncomfortable, you could also be here where one foot is just more in front. Actually, I think this one gives more stability though. And then you push the left hip out and lift the arm overhead. And again, hold for 3 to 5 breaths. And then you would slowly come out of it. And then the other stretch that I recommend that you can check for tightness in your thigh muscles and your deep hip flexors is going to be in kneeling. So what you'll do is come down into this position. If kneeling is challenging, you can always put a blanket underneath that knee. You're gonna pull your lower abdominal muscles in so that you've given our pelvis some stability. And then with your forward leg, your right leg, you're going to basically lean into it by bending your knee, but this part of my body is staying straight. So my abs are pulled up and in, I'm coming forward, and if I have tightness in my upper quads anywhere or in those deep hip flexors, I am going to feel a stretch. Make sure when you do this though that your lower abs are engaged, because otherwise the tendency, if they're not, is to hyperextend your back. And once you do that, you're gonna take any stretch you might have had here out of the picture and it's gonna hurt your back. So you need to pull up and in and then hinge or lean forward with that front leg. When the front leg comes forward, you wanna make sure that you can still see your toes so that it's not putting too much force on that front knee. And then you would just slowly come out of it, switch sides, pull up and in, maybe move that front foot forward a little bit, and then come forward. Okay, again, if you have any knee issues, I highly recommend putting a pillow or a blanket underneath your knee for some support. Okay, and then you just slowly can come out of it. There we go. All right, Brenda, there's my A to your Q. Let me know if you have any questions or if anyone else who's watched has questions. I would be more than happy to answer them. Just post them in the comment section below.